Hi, it's Nurse Kathy. It's time for 5 on Fridays again. Well, today we're going to talk about back pain. Now, back pain is the most common reason that people go to the doctor. It's the most common reason people miss work, and it's the leading cause of disability. Now, surgery is rarely needed to treat back pain. Simple home treatments and proper body mechanics generally can heal your back in just a few weeks. Now, there's all kinds of symptoms that are related to back pain. You can have anywhere from an aching to a shooting pain, or burning or stabbing pain. You might have pain that radiates down the leg, and it's usually one leg or the other, but not generally both. Or you can have pain that increases when you bend, twist, lift, stand, or you walk. Now, some of the causes of back pain can be linked to muscle or ligament strain, and that's usually related to heavy lifting, turning, or twisting. Now, you can also have bulging or ruptured discs. Now, the discs are the cushion pads that are between the vertebrae of the spine. So, just a little side note though, you can have a disc condition, but you can have it without pain. So, just because you have a bulging disc doesn't necessarily mean that you're going to have associated pain with that. Other causes are arthritis of the spine and lower back, and then osteoporosis, and that's a condition that results in the bones becoming brittle and porous. Now, anyone at any age can develop back pain. Now, if you haven't experienced back pain in your life, you're very, very fortunate. There are some risk factors associated with developing back pain, and as I said, age. The most common age for developing back pain is around the age 30 to 40. Another cause or risk factor to developing back pain is lack of exercise. Your muscles become weak, they're not used. Now, excess weight is also a risk factor associated with back pain. Excess weight causes stress on the back. Now, diseases such as arthritis and cancer can also trigger back pain. Improper lifting can trigger back pain. It's because you're using your back instead of your legs, basically poor body mechanics. Also, some psychological conditions such as depression and anxiety can trigger back pain. Now, here's one you probably didn't think of: smoking. Smoking can cause back pain because what happens when you smoke, blood vessels are constricted, which decreases the flow of blood to the spine. So that will increase your risk of osteoporosis. And here's another thought about smoking. Smoking causes harsh coughing, and that's related to possibly some disc conditions. The harsh coughing can cause you to rupture a disc. Okay, what can you do to prevent back pain? Well, exercise. Exercise probably is the number one thing you can do. Low impact activities to increase the strength and endurance, such as walking, swimming. You can also do yoga. You also want to build the muscle strength and flexibility, that is your core muscles, your abdominal and lower back muscles. Because if you strengthen the abdominal and lower back muscles, they will act as a corset to help support your back. Now, exercise not only prevents back pain, but it can also relieve or heal back pain. Some people think because they have a sore back, they've done something that they can't do anything at all. They avoid the exercise. Well, that's wrong. You still need to keep moving and using those muscles. Now, you don't want to do the exercise that triggered lifting or bending or whatever you did to trigger the back injury, but you also want to keep moving. And then as your symptoms heal and get better, then you can ease back into normal routine. Now, also maintain a healthy weight to reduce the stress on your back. Reconsider diet, exercise, quit smoking, and then follow the SMART hints of stand smart, sit smart, and lift smart. Now, with stand smart, don't slouch. And if you're standing for long periods, it'd probably be a good idea to use a low footstool. And what you can do is kind of shift and put one foot on the low footstool and then alternate during certain periods of time, just to kind of shift that weight a little bit. And then also to sit smart, you want to make sure you have a seat with a good lower back support, armrest, and if it's a work chair, make sure it's a swivel chair. Put a pillow or rolled towel at the small of your back. You want to keep your knees and hips level, and you want to change positions at least every half hour. Now, as far as lifting smart, let your legs do the work. Keep your back straight, don't turn, bend at the knees, keep the objects close to you, and if it's a particularly heavy item, it's a good idea just to ask for assistance. Now, when you're looking at those 3 SMART hints, take in consideration your workspace, because a lot of us are working from home now. So you might need to kind of change up your workspace in order to accommodate and relieve some of that back pain that you might be experiencing. Now, just a reminder also, in addition to what we've already discussed, you might want to try some other home therapies such as over-the-counter NSAIDs or their anti-inflammatories. And these are drugs such as ibuprofen, Aleve. Also, you can try both hot or cold packs to the affected area, but please use those with caution because you don't want to cause any damage to the skin tissue. Most back pain can be relieved with the home therapy, but should you continue to experience back pain or the pain becomes more severe or you start experiencing experiencing some numbness or tingling, especially in the legs, or you notice there's a change in your bowel or bladder habits and you know it's directly associated with the back pain, you need to consult your doctor right away. Well, that's all for me, and Ashley will see you on Monday, and she's going to talk about sleep aids.